Hello, everybody. A very good evening, and welcome to the Science Chats. Today, I have a very special person and something that we rarely talk about, that is genetic counseling. So, if you're here, send us your highs and hellos in the comments. It gives and boosts our inspiration and energy. I welcome my guest, Dr. Rachana Ray, who is a genetic counselor by profession. And today we will see that how this particular aspect of science can be implemented in our dental practice or in our dental education as well. Welcome, Rachana. Thank you so much for accepting my invitation and being here today.
Thank you, Dr. Gati. Uh, Thank you, everybody, for joining us and manage some time to be with us from your busy schedule.
So, well,
Today,
yeah,
yeah,
Rachana,
yeah,
please.
please. Yeah,
So
it's
basically today we what we are doing in these science chats is like when we talk about genetic counseling, Dr. Rachana, uh, generally it's more into the medical sciences aspect as much as
yes.
my knowledge goes. And this is a kind of specialty science where we really need to know certain things. I mean, anybody cannot become a genetic counselor next day. So, in this aspect, today I would like to understand certain things from you. Your knowledge, your addition will be very helpful for us and for all the viewers who are watching us right now or who will be watching the recording of this session. So, the first thing first, like, what is genetic counseling? So, that would be my first question and a very straightforward question to you.
Okay. Before I go or explaining what is genetic counseling, I would like to add three sentences on what is gene and why it is important. See, genetic counseling is basically dealing gene. What is genetics? First of all, genetics is nothing but dealing with gene, the biological science that deal with gene. And why that is so important? Because gene is the hereditary unit which is bearing the characteristics and passing on from parents to their child. So that is the concern area. What is we are nowadays looking for. Now, excessive research work is going on throughout the world, and people are more concerned about human genome project, population genetics database. So, what it is, why it is so important? Here, the genetic counselor role is coming. They are actually trained in genetics and molecular biology and biochemical pathway as well, and they are forming a bridge between this knowledge research work to the common people. So they are guiding what is there in the research, how it will be implemented to the common man so that everyone should be benefited. They can be guided through clinicians what needs to be done, what needs to be done to avoid in future uh, for any kind of a disorder which is hereditary, which is bearing or passing on from parent to the child. So we can have a healthy population. That's the main concern of a genetic counselor.
I think that's very well. You have explained a complex thing in a very simple way, and yeah, so I do agree with that. Basically, I think this speciality of science helps us to more of in a more kind of predictive way, and in that way, I think being in the health as a healthcare professional, if we have at least not the entire thing, but we have connection with genetic counselors, or we know how to approach them, or we have the basic knowledge when we are dealing with patients. I think that makes a lot of difference. So so since it is a specialty in itself, can you tell us that what is the scope of genetic counseling both globally and India as well? I think that is one thing which everybody would like to know from you. Yeah.
So here today I'll be focusing more for the dentistry, how it is actually we can implement. See, dentistry or dental student globally initially there is hardly any scope to learn genetics in their curriculum. Even long back it was not the part of their curriculum. But nowadays globally the kind of research work is going on. People have understood the need. They have started putting in their genetic curriculum and dental curriculum so that the students will be more aware of that what is the need of learning genetics and how it will be implemented. Because if you see like a disease which is sickle cell anemia or thalassemia, it is mostly known as a blood related disorder. But if you go deep in genetics related topic with this background, you will see there is a certain correlation when the craniofacial disorder and sickle cell anemic patient having the kind of a facial expression and features which is slightly different with the control group. So here is the beauty of learning genetics for the dental student or the dental practitioners, so that they can correlate it as not as a blood disorder. They can try to find out is there any genetic involved, so that they can guide the patient and take a call, and it will be more precise therapy for the patient as well as for the population.
Right, right. Yeah. Dr. Archana, what kind of technologies are basically used or being more commonly applied in the field of genetic counseling? Are there any specific technologies, or like is the common molecular biology technologies? Can you enlighten us on that?
Yes. See, for any counseling part, normally we follow three different category of testing. One is molecular biological testing, one is genomic testing, and one is biochemical testing. Now, because of this pandemic and this coronavirus thing, we all are aware of RT-PCR, whether we understand or not, but we are very well versed with the terminology. This RT-PCR is nothing but a molecular testing. Now, RT-PCR, if we tell that what is gene, gene is lies within our cell nucleus. I don't want to go deep, but this thing DNA. So DNA terminology everyone knows. So once we want to see the DNA, is there any changes in our DNA? We go for PCR technology. That is a molecular techniques. If we want to see the mRNA level, so we go for RT-PCR. And if we go for protein level, because DNA to we are getting mRNA, mRNA to or RNA to protein. And for protein part, we do normal biochemical assay. Like when we are having fever or some kind of a issue, we go for normal blood tests. These blood tests are called biochemical assay. These three thing is very important. Another one is a cytological analysis or cytogenetics, where we analyze the chromosomal abnormalities. That is, we can say karyotyping or fish analysis. Fish analysis, people may not be well versed with the full terminology, but fish is the term that people are very well know. People know it very well that they should go for any kind of, even during pregnancy also they do check for karyotyping or fish if there is a issue with the triple marker or dual marker test. So these are the common tests normally. Even the mutation analysis, if there is a mutation, SNP analysis, that is also a part of NGS, that next generation sequencing that is called. So these are the tests normally we do follow, and also whole genome sequencing. Although whole genome sequencing we prefer for research purpose, not exactly for the treatment. For treatment, we prefer SNP, the single nucleotide, the SNP test. That is a particular region we do amplify or we do see the sequence. Is there any issue with the sequence?
Yeah, I think I go with that. And yes, as you rightly said, that it's about the hype that we know RT-PCR right now. But yes, so the very well you have explained us the different types of categories of technologies that are basically used. And yes, I think fish that you're talking about is just another higher version of our normal karyotyping, that is fluorescent in situ hybridization, if I am not wrong. So I think yes, though these specialities are existing, these technologies are existing, and I think genetic counseling, as such, is a scientific field where we, you know, converge all these technologies, and we basically genetic counselors, in my own way, I would say that they help us to understand what these test data is basically, and we can communicate it well to the patients as well. So as you rightly said in the beginning, it's kind of a bridge that genetic counselors actually form between the research data or the test data with the healthcare professionals as well as the patients. So I think you mentioned about craniofacial disorders. Very rightly said. When it comes to our dental profession or in dentistry, the specialists, particularly the oral and maxillofacial surgeons, the pediatric dentists, and many other. I think in almost all branches of dentistry, people come across, healthcare professionals come across patients who have some kind of deformities, or maybe they are syndromic patients. So at the first go, they might not be able to understand. So in this context, I would like to ask you that what are the basic or maybe the primary aspects a dentist should know when or they should take a decision where they need to go to genetic counselor. So what are those basic things they should know about when they are getting such kind of patients?
So mm I'll take few examples for,
Right.
like, when a mother is infected with mutant, that what you called, uh, okay, I'll come to this later. There is a probability or correlation between the enamel formation and cavities. So that is very common today. The kids are getting affected, it keeps on coming. Though it is very sporadic. Sporadic means it is happening spontaneously because of our food habit, because of our lifestyle. But there is a very minor degree. This cavity formation is hereditary. Now, if a child is keep on getting affected, if the parents are also having that kind of, if we get, see, for genetic counseling, knowing disease or disorder of a particular patient, rather than, it is more important, you should know the family background, family history, whether they are having any kind of a history or any kind of a disorder running. So that way, it is more easy for a clinicians or for a practitioner to correlate or to identify or to guide that patient to the genetic testing. Because if that is the case of a cavity formation, so probably they can ask for few genetic tests. If it is genetic, if it is been identified, they can take a call. Otherwise, they can do the normal procedure the way they are doing. So that is one thing is very precise. And another thing is when it is seen if the mother is affected with mutant streptococci, then it is being passing on or transmitting to the infant as well. But it is also seen the female child is getting more prone or infected rather male child. So these are the thing. If uh, dental practitioners will look into, they can clinical things will be correlated with the genetic trait and can work accordingly. Also, the cleft is a very congenital disease, and you know that there is all of a sudden it is happening, and that time patient and the parents are more panic how to get the things done. Rather the only thing they can go for surgery, and they are doing the corrective action. This is one aspect, so that at the initial stage whatever the problem will be overcome. But if it is genetic, because it is always run with the autosomal dominant trait, so if it is autosomal dominant trait and if it is genetic, then we need to look into that also, because later future that child may have, can develop certain other symptom like mental retardation. Even those kind of a child will be more prone for certain specific cancer type. So that genetic analysis, when the practitioner will see the cleft, so they should not only treat that, as well as if they can ask the patient or they can guide them for go for some genetic testing, so that way they can help them. So this is one thing. Even for the hemifacial microsomia, although this is sporadic, means it is happening because of the environmental factor or for unknown reason, but
Right.
1 or 2% cases it is autosomal dominant. So if it is autosomal dominant, means if it is running because of the hereditary issue, that should also be look into. So there are the thing the practitioner will more focus.
Hmm.
So it will be helpful for. them also, and as well as we can guide the patient.
Right. I think you have almost answered my half of my next question, which was like if a patient with craniofacial defect comes to a clinic like a dental clinic, so what aspects should the dentist consider to provide genetic counseling to the patient, or maybe the primary, not exactly how the genetic counselor provides a counseling, rather maybe the initial advice, as you rightly said, and maybe then if required they can take the help of the expertise of the genetic counselor. So this was actually my next question, and if you want to highlight more you can just add on, and I think you already answered this, because I think yes, cleft palate, cleft lip are kind of a thing which particularly oral and maxillofacial surgeons who are specialists in this area, they deal a lot with this type of patients. And just taking just taking a trail of what you added, I think the when the family history, as you said, is very important. I think in case of this craniofacial malformations or any kind of syndrome, when that couple is again, aspiring to have the second issue or second child, when already they have the first one who is having some kind of craniofacial defect, do you think that in this case also the role of genetic counselor becomes prominent?
Yes, so I do answer one by one. First question you had, how to guide uh,
Yes,
from the side of dental clinicians that to the patient.
correct.
See, uh, they should go whenever a patient is coming. Initial level, they should ask for their family history. They
Mm,
should try to form a pedigree chart and try to understand both from the paternal and maternal things, so that what will happen, they will get some kind of a guideline. Not only for the cleft will be running in their family, there could be some other genetic
correct.
factors disorder as well. So if they have that kind of a thing, they will be little sure that this family is having the history of some kind of a genetic disorder. So that will help them to further analysis, or even may not be the first time. After 15 days or for a month, the when they will ask them for the repeat test, or probably for the follow up, that
Mm,
time if still there is no improvement, or hardly any complication has started showing, or may giving some other
correct.
clue, probably that time they will. It is not always the at the first time you will get to understand the genetic things, but
Correct.
gradually, definitely with the follow up and with the history, so the clinician also will be having in the back of the mind, "Oh, this patient is having this background, and ultimately it responding with the medicine or with the treatment this way." So that way they can gradually understand whether the patient is needed any genetic counseling or genetic testing, or the regular thing will work for them. This is your first thing. Now for the second part, see, if I'll add another two three things, then only probably I'll be able to give you the answer if the already they are having the first child with specific disorder, or some kind of a
Right.
special child they are having.
Mm,
Now, for genetic counseling, we are having two broad aspects, or we are dividing the counseling in two categories.
mm,
One is prospective and one is retrospective. Now, what is the meaning of that? Prospective means the true prevention, means where we can guide, or we can tell the patient that you can avoid the passing on your deformed genetic characteristic to the next generation. That is called the true prevention. And the true prevention is possible when there is no expression of the genetic trait in their family, means it is not running in their family. How it is? It is like we all are bearing 23 pair of chromosome as a human. Among that 22 pair is autosome, one is sex chromosome. Autosome, why I am explaining, so it will be giving you the clear picture that how the things are working. So autosome, we are having two copies of X chromosome, and sex chromosome we are having for female two copies of X chromosome, and for male one X and one Y. Y is the male characteristic bearing thing. Now either this genetic trait will be passing through autosomes or through sex chromosome. If it is autosome, like sickle cell anemia or thalassemia, as I mentioned, it is autosomal recessive trait. And what it is, cleft plate or cleft leaf or hemophyseal thing, that is autosomal dominant trait. Now, what is the meaning of recessive and dominant? Both the genetic defect or disorder. Now, we can do true prevention when we know the trait is not running in the family. But there is also a thing that we normally overlook. Most of the people, we live as a normal without any symptom, but we are the carrier. That is the problem creator of today's world. Now, when it is carrier means the recessive part. The both the X chromosome, one chromosome is defective, but it is not expressing. So the male or female person, though they are the carrier, it is not expressing for their life. So it is they are pretending that they are as a normal person. When this one two carrier person is getting married and one defective X chromosome from a male and female, both the things are passing to the child. So child is bearing both the defective X chromosome and they are showing the symptom or disorder like sickle cell anemia and thalassemia. So we the true prevention is, if we go for genetic testing, if we see they are the carrier, either we would advise they should not marry, or they should think about before
Right.
they conceive. So that is called true prevention, so that we can avoid the situation. Now, for the next is the retrospective.
Hmm.
Retrospective counseling is that, what is your question? When it is running within the family, means already the couple is having one special child with some deformities or some kind of a disorder. So
Hmm.
in that case, what we can do, or first of all, we have to tell gene we cannot change. Although we
Correct.
are talking about counseling and all, if it is present, it you have to bear that defective gene throughout your life. Then why it is so important that we are discussing? Because we can take a call of that expression so that it should not pass on to the
Hmm.
next generation, or we can change with the gene therapy or target medicine therapy so that we can
Right.
alter the expression of the protein or at genetic level. So we can just modify. We cannot change the gene. Now, if the couple is already having and they are planning for, obviously it will be with the uh, various kind of a genetic test to be done. If
Correct.
already they have conceived, we need to analyze the fetus through amniocentesis or
Hmm.
through Fourier CVS test, so that
Yes.
we
Yes.
can see is there any chromosomal deformities. If not, they can go ahead with the pregnancy. If it is there, we have to ask them to terminate within as per our government rule. So
Right.
that is more for retrospective, and we do in that way.
I think
Sorry,
that's
I'll take a little more for your this question, but I thought of
no,
little.
I
I'll
I
share
think
it
very
with
well
you.
explained, and you have given in a very, in a very simplistic way, because it is the way you explained it is very easy to understand, and I think this conversation will be definitely beneficial whoever is listening, and this would open up a newer area, at least when it comes to our dental sciences and dental education. So I really thank Dr. Rachana for your time today and for joining me in this science chats. And I think we will come up with more such conversation with you, and in the future, in the near future, where we will definitely try to understand how this fascinating field can be incorporated, or whether dental professionals or dental students might take this up, or think this as a career as well. So I think that's in our bucket, where we can in the future I'll get you again on this.
Yeah,
And I
sure, sure. My pleasure. And
yeah,
thanks, Dr. Gandhi, for this platform. Really
thank
appreciate.
thank you so much. Thank you everybody for watching and staying tuned. And if you have any questions, you can put it right away, or you can, when you watch the recorded version of this session, you can put it in the comments. And I think we will pass these questions to Dr. Rochana, and you will get your answers. Thank you so much. So everybody take care, and good night, Dr. Rochana. Good night, everybody.
Good night. Thank
Bye.
you. Thank you, everybody.